So everybody come around. The first thing is what? The pericardium, the visceral, and then the parietal. Again, we will not see them here. I'm thinking that this covering is part of it. They didn't peel all of it off. So you see this roughness out here? This is going to be the parietal pericardium, and then.
Sorry, can you point it this way too?
Can you see? We can't see from there. So the outermost covering is usually it's actually the parietal pericardium is an actual sac. So you can actually, if it was around it, you can actually hold it and realize that it is separate from the heart itself. Okay. Then the outermost membrane, which is the visceral pericardium, is also what? The epicardium. Okay? So this outside, all this is epicardium. All that is epicardium. What's the next one? Myocardium is the muscular layer, the middle layer. So you see the left side is always thicker than the right side. So actually, to determine what left from right, there's always, if it's a cut one, a slight one, always look at the myocardium and you know. If you can't figure out, you know that the left one is the thicker one. So that's left versus right. The outermost part of the myocardium is the superficial. The vesicle part is the deep myocardium. What's the next one? Next thing?
Endocardium.
The endocardium, the inner lining. So you see, look at the inside of this. You see that the lining in here is a little bit slightly lighter than the myocardium. If you look closely, you can actually see, looks like there's a membrane that is covering the lining.
This part right here? This little line right here?
Not the line, but when you look at this entire chamber, see the lining of the chamber? You see that it's lined with something different from the myocardium.
Okay.
That is the endocardium. All right. So when we're done, you can actually take a look at it, come around and take a look at it. But the lining of the chambers, that is the endocardium. What's the next one?
The aorta.
The what? The aorta?
Oh, yeah.
This is the aorta. You can't miss it. Right? That's the aorta. This is the aorta for this one. This is the aorta for that one. This is the aorta for this one. This is the aorta for this one. This is the aorta for this one. How is it easy to see? It's the biggest. Right? And it will have the branches.
And it's arched.
And it's arched. Exactly. All right.
The vena cava is the next one.
The vena cava. The vena cava is what? The vessels that empty into which part of the heart? Right atrium. All right. So with these ones, this ones you can't see the vena cavas, but this is the right. This one is not there. This is what? This is your right. Okay. So when the right one, this is your superior vena cava. Goes into the right chamber. This is the inferior one. All right, and these are sheep and pig. I don't see the blood vessels have been removed, or if it's there, it was not stained. They're there, but they're not stained. But you see, this is what the interventricular sulcus. So this is your interventricular vessels. In terms of which one is artery versus veins, I can't tell in the preservative. So, but you can see them there. Okay. And actually, I didn't see this yesterday, but it's there. The coronary sinus. Is it listed there? Okay, that's why I didn't point it out yesterday, but it's there. That's the coronary sinus.
Pulmonary trunk.
Pulmonary trunk. See this? The next biggest vessel has been cut off. This is number 8. Actually, there's a key in there, so you can use it as well. So this is the pulmonary trunk. Next one.
Pulmonary veins.
The pulmonary veins, you're not going to see it on this. The pulmonary veins are going to be the one that empty into the left ventricle, right? I mean the left atria. So here, this is the left atria. We can't really see it. Okay. See, this, I was making sure this will not go here. This only goes here. This is the inferior vena cava. But this one goes here. So this is what? Your pulmonary vein. Okay. So during an exam, if you need to, put your pencil in it, poke it, so that you can see where it goes. Because where it doesn't go to, it will not go. All right?
So where, can you turn it this?
This is your pulmonary vein.
Okay. Is that your pulmonary trunk?
For this one, yes, it's coming from the right side. So this is the pulmonary trunk. All right. Next.
Right atrium.
Right atrium, that's easy, right?
Yep.
This is your right atrium.
And
That's the left atrium. What else?
Right auricle.
The right auricle. What are the auricles? Remember the flaps? These flaps on the atrium, these are your auricles. All right, what else? Right and left. So the right one is on the right atrium, the left one is on the left atrium.
Right ventricle and left ventricle.
Okay, so right ventricle, it will always have the thick myocardium. Left ventricle is the other one.
Interventricular septum.
Interventricular septum is what separates the two. So for this is number 14. All right, what else?
Tricuspid.
Tricuspid valve. Where's the tricuspid valve? Between the right atrium and the right ventricle, right? This is your tricuspid valve. And then this is your bicuspid. All right, what else? Probably trabecular chordae tendineae first, right?
Yeah.
The chordae tendineae. So these are the cords that are tendons. That's that will help you remember. The chordae tendineae. These are the strings that hold the valves in place, and they're connected to what? The nipple muscles, the papillary muscles. All right. So this is papillary muscle. These are the chordae tendineae. What else?
Aortic semilunar bulb.
See them here as well. These are your chordae tendineae. These are the papillary muscles. Chordae tendineae. I'm sorry, what did you say?
The aortic semilunar.
The aortic semilunar valves. You see these semilunar valves? This is what? At the base of this is the aorta. This is the pulmonary trunk. So this is what? The aortic semilunar valves. These cups. You see it? That is aortic system. So this is the aorta, entrance of the aorta. So these are the aortic semilunar valves. The pulmonary one is cut off. I'm superimposing this over there. Actually, I was thinking this is it, but that is not it. This is still the aorta one. Pulmonary one we can't see from this. Yeah. Okay, what's the next one?
Moderator band.
Moderator band, where is that one? Left or right? Atria or ventricle?
Right.
It's right.
The left one doesn't have
Right what? Atria or ventricle?
ventricle.
Right ventricle. All right. The moderator band here has been cut off. There's a remnant of it. Maybe this one too. Remnant of the moderator band. What else?
Steer.
There's a left ventricle. The pieces of it. That's it. All right, that's it.
For today?
No, we have to do an EKG. And that's